So I am currently reading a book titled The Invisible Cure. This is a book that was published in 2007. It is written by Helen Epstein. It's titled The Invisible Cure: Why We Are Losing the Fight Against AIDS in Africa. Um, this book is one of my favorite books because it actually gives you a kind of that dynamic and complex um, impact of HIV, specifically in the developing world, where we are talking about multiple, various, multifaceted socio-economic, cultural factors, and some of them are political factors that actually perpetuate the spread of the disease in these particular communities versus in the developing world, right? And Helen Epstein is somebody who I have interviewed for a different purpose, but I will definitely be sharing snippets of that interview with Helen on this channel. But I want to read a very specific page from Helen's book, which explains some of the reasons why I started this channel and some of the reasons why I continue to want to advocate for women, adolescent girls, and women who are living with HIV, to advocate to raise awareness on why HIV infection rates continue to increase at very alarming numbers in other parts of the world, right? In this case, she talks about the underground economy of AIDS, right? I am reading direct from the book. This is page 245, where in this case, Helen, the author, is actually explaining why HIV is a gendered disease, right? She says, throughout history, poor young women have used their sexuality to cope with poverty, a trend that has almost certainly increased with economic globalization. Traditionally, most poor women in developing countries worked on family farms, and their sexuality was generally supervised by their relatives. However, as the system of small scale family based agriculture has become increasingly unsustainable, impoverished young women all over the world have responded by negotiating new survival strategies. Interestingly, impoverished women in Africa and Asia have tended to adapt to this situation in different ways. And this may partly explain why HIV infection rates in Southern Africa are 10 to 100 times higher than they are almost anywhere in Asia. In Asia, many impoverished women end up in the organized brothels of Bombay, Bangkok, Shanghai, and other cities. And in India, there are even dedicated hereditary castes of prostitutes known as devadadis. I may not have said that correctly. These women are at high risk of HIV, but because their male partners tend to have sex with them infrequently, and because condom use is increasingly the norm in encounters with prostitutes, these men and their wives are at a relatively low risk of infection. This probably explains why in Asia, HIV rates in the general population are low and stable or declining, and mainly concentrated where the brothels and prostitutes are or where there are large numbers of intravenous drug users. Compared to Asia, a relatively small fraction of impoverished young women in sub Saharan Africa work exclusively in the sex trade, and the continent has few organized brothels. Instead, many poor African women work in the informal economy as traders, hairdressers, shopkeepers, and so on. Although these women are not considered prostitutes and have many fewer sexual partners than Asian prostitutes do, some of them make casual sexual arrangements with male facilitators. For example, the man who delivers the clothing they sell, or the police officer at the roadblock, or the man who rents them space in the market. Such relationships, though implicitly cohesive, are often based on friendship and trust, as well as economic expedience. Nevertheless, the risk of contracting HIV in transactional relationships can be just as great as it would be if the women were prostitutes with hundreds of partners a year, because when it comes to HIV risk, it is not only the number of sexual partners that matters, but whether those partners are part of a larger sexual network involving long-term concurrent relationships. This may be why HIV in Africa this may be why HIV rates in Africa tend to be lowest in farming communities that are largely isolated from the cash economy, and highest wherever the informal trading economy is most active, such as in small market towns along truck routes or besides large developmental projects in peri-urban slums like Chitungwiza, or in those rural areas where people have abandoned farming and rely on remittances from migrant workers. In both Asia and Africa, the AIDS epidemic is driven partly by the struggles of poor young women in declining agrarian societies to find new livelihoods. Why have Asian women tended to resort to formal prostitution, while African women have tended to rely on informal sexual battering in longer term relationships with men they know? The Australian demographer John Caldwin has suggested there may be historical reasons for this. In Asia, as in Europe, land was traditionally a family's most valuable asset, and families had to guard a daughter's virginity to ensure she did not lose her dowry to a rogue pretender from a lower social class. A clear cultural distinction emerged between good or moral women who had sex only in marriage and fallen women who became prostitutes. All right, so I will continue to share snippets from this book, which I think is very good at sharing why HIV is not just about the disease, why HIV is really a case of the influence of health inequalities, of health disparities, of the lack of whether it is access to information or the lack of access to health resources or the lack of access to basic sanitation such as water, right? So yeah, we will continue to journey together on this YouTube channel, Health News and Updates with Bui, and we are on the Invisible Cure. Thank you so much, and I'll see you next time. Don't forget to subscribe and, of course, like this channel. Thank you. Bye.